I'd like to introduce our next speaker, Dr. Kenneth Ramsey, who comes at this both as a service provider at the state level, as the president and CEO of Gateway Rehabilitation Center, which is a large treatment system based in Pittsburgh, but also comes at this from a national perspective, having been the past chair of the National Association of Addiction Treatment Providers. Dr. Ramsey.
Thank you. Also want to thank you, Mike, Dr. Flaherty, for the invitation for me to be here to represent the private treatment providers. It's important, I think, that our group be part of this discussion. And I applaud and appreciate what you and Bill and Tom and other leaders are doing relative to recovery-oriented systems of care. And I welcome it. That being said, all this talk about recovery-oriented systems of care scares the bejeebies out of the treatment providers. I'll tell you why in a minute. Let me tell you a bit about Gateway, and I want to do this because this will partly answer my issue about being scared here. Gateway is a private, not-for-profit treatment facility based in Pittsburgh with over 20 locations in Ohio and Pennsylvania. We offer a broad system of care. We have a prevention division, a community corrections division of about 200 beds. In total, our system has about 450 beds. We have detox, inpatient, a couple of levels of inpatient, a series of outpatient care for adults and kids. We have 3 halfway houses and 1 halfway house for adolescent males. I believe it's the only one in Pennsylvania. We have 600 employees, and we see 1,700 patients a day. And I say that not to boast, but because this presents a real problem for us. How do you get all of these folks into a recovering-oriented system of care? And we're very concerned, not just at Gateway, but on a national level from the private sector, about how will this be funded? What will the implications of this be for all of us? Most private treatment programs operate on a very tight budget. Most of us don't make enough to meet budget from operations alone on a fee-for-service basis, and rely a lot on fundraising. So that when there's something new that comes along, it presents a bit of a crisis for us because we really don't know how we're going to deal with that, particularly those of us who have very large systems of care where a patient may be living 5 states removed from where he's receiving treatment. So that's one of the concerns that we bring to the table, Mike and Bill. That the issue of funding has been raised a number of times, but I don't want to underestimate the importance of that, because too often I've seen where the funding model hasn't caught up with the concept new idea model, and it kills the new ideas. So it's really important to get the funding, and it needs to be new funding, new dollars. And those of you who are public policy state officials, please don't just move money around. We need to keep the existing system, and we also need to define new ways to support this effort. And there was some mention about educating the public. I think we need to urgently now begin to re-educate funders, public policy officials, but particularly the general public. The general public, in my experience, is not really, doesn't understand the importance of post-treatment monitoring and support. For example, we have a 28-day Minnesota model treatment program. We also have very low length of stay inpatient care. More often than not, we get patients who come in to us and say, I want the express model. I don't have time to be here for 28 days. I had a mother call me a couple of weeks ago and said that I have a 16-year-old son who has an addiction problem. I'd like to be able to get him to monthly naltrexone injections because we don't have time for rehab and we don't have time to go to all those meetings. So we're dealing with that. The pharmaceutical industry is pretty much taking over TV with about every third ad is about some drug that we all need if we can't sleep in 2 minutes or if we have a restless leg or whatever. And so society is coming around and they want a quick fix, so to speak. They want to solve their problems, and families, and 40% of the families that we see in our system don't want to be involved with treatment. They don't see it as their problem. And trying to get them tied in, and trying to get them to buy into an extended system of monitoring and support will be a difficult task. So I say that because this change, much needed, is in our private treatment system. We've been doing the same thing for 60+ years, and it really needs to be redesigned.
In long-term recovery,